poetry initiative.
Welcome to this episode. Today, we're diving into a really compelling document titled Reasonable Expectations, which details a patient's experience following a complex spinal surgery at UT Physicians Spine Center.
Yeah, Liam. The patient, Lowell Unruh, underwent an ACDF surgery on October 14, 2024, at Texan Methodist Hospital. For those who might not be familiar, ACDF stands for anterior cervical discectomy and fusion. It's a fairly common procedure to relieve nerve pressure in the neck by removing a damaged disc and fusing the vertebrae.
But in Lowell's case, the surgery didn't go as planned. He suffered two serious complications: a 5-centimeter perforation of his esophagus and a viral infection in his spine. Both are significant, especially the esophageal perforation, which is rare and potentially life-threatening.
Exactly. An esophageal perforation is a tear in the esophagus, and it can lead to severe infections like mediastinitis. It requires urgent treatment because the risk of sepsis is high. Adding a viral infection in the spine just makes recovery even more complicated and risky.
So Lowell's document isn't just a medical report. It's a detailed claim outlining what he calls his reasonable expectations from UT Health, framed as ethical and moral obligations.
What really struck me was how Lowell frames this not just as a financial dispute, but as a heartfelt appeal to ethics and honor. He explicitly calls on the leadership at UT Health to act honorably and take responsibility, referencing Dr. Henrik as an example of integrity.
Yeah, that ethical framing is crucial. It shifts the conversation from numbers and bills to accountability and respect. Lowell repeatedly emphasizes that doing the right thing means stepping up and acknowledging responsibility. It's a powerful moral appeal.
It really is, and it sets the tone for the whole document, not just about money, but about justice and respect.
Let's dig into the financial details. Table 1 lists Lowell's direct out-of-pocket expenses related specifically to the esophageal injury and spinal infection. These include copays and fees from several providers.
The amounts are quite specific. $1, $650 at Methodist Texan Hospital, about $900 at University Hospital, $65 for a PICC line copay at Paragon, $225 for physical therapy, ENT, and infectious disease copays at UT Health, nearly $480 in additional Paragon copays, $615 for imaging copays, and $48 for prescription medications.
Adding those up, the total out-of-pocket expenses come to roughly $3, $750. This really highlights the financial burden patients face even after insurance, especially when unexpected complications arise.
And these are direct costs that impacted Lowell personally. It's a reminder that complications don't just affect health, but also finances.
Moving on to Table 2, Lowell outlines future medical treatments he expects UT Health to provide, with all copays and fees waived.
That's a comprehensive list. Up to 20 acupuncture visits per year, 15 physical therapy sessions, 5 speech therapy visits, 26 biweekly manual therapy sessions, 6 pulmonary therapy sessions as needed, 2 radioablation procedures spaced 1 to 2 years apart, and imaging as required for ongoing monitoring.
What's interesting here is the note that while these services appear as expenses to UT Health, most can be billed to Medicare. So financially, these are offsets, meaning Medicare reimburses much of the cost, reducing the net financial impact on UT Health.
Right. It's kind of like the hospital gets a partial refund from the government for these services. But Lowell still expects them to be provided without additional cost to him. Waiving copays removes financial barriers to his ongoing care.
That's an important nuance. It reflects the complex interplay between healthcare providers, patients, and public insurance programs.
Exactly. And it shows how healthcare finance isn't just about sticker prices, but about who ultimately bears the cost.
Now, Table 3 summarizes Lowell's overall claim. It includes compensation for pain, suffering, and lost days, calculated at $750 per day for 20 days, totaling $15,000.
Then there's a Medicare benefit day reimbursement of about $32,400 for 19 days, calculated at roughly $1,700 per day. Adding the $3,750 from Table 1, the total claim comes to just over $51,000.
That's a comprehensive approach, combining direct costs, compensation for suffering, and the value of hospital days covered by Medicare. The inclusion of the Medicare reimbursement is a technical but important detail, showing how hospital stays factor into the settlement.
And the document closes with the phrase, "Doing the right thing is never the wrong thing," reinforcing the ethical appeal.
Beyond the numbers, this document challenges healthcare organizations to balance financial realities with human dignity and accountability. Lowell's appeal to leadership honor and the example of Dr. Henrik invite reflection on personal integrity and institutional responses to medical errors.
It's a reminder that patient-provider trust is a contract of reasonable expectations, where transparency, responsibility, and quality care are essential.
Absolutely. For healthcare professionals and administrators, this is a candid glimpse into the aftermath of surgical complications from the patient's perspective. It's not just about clinical outcomes, but about respect and doing the right thing.
And for our listeners, it's an invitation to think about what reasonable expectations really mean in healthcare. Beyond policies and procedures, it's about ethics and accountability.
Well put. This document combines medical facts, financial details, and a heartfelt ethical appeal in a way that's both sobering and instructive.
To sum up, Lowell's case highlights the complexity of healthcare liability, the financial and personal consequences of complications, and the importance of moral responsibility in healthcare delivery.
Thanks for joining us for this discussion. We hope it gives you a deeper understanding of the intersection between patient experience, healthcare finance, and ethics.
Until next time.